Are we ready to talk about treatment presentations?
Oh, we are
Here
ready.
we go, ladies. In three, two, one.
The best leadership happens when you step away for 10 minutes.
This is Back in 10. Hello, everyone, and welcome to Back in 10. I am Savanah.
And I'm Jen.
And on today's episode, we are going to discuss treatment presentation. Treatment presentation that converts and the communication strategies that help to build trust with those patients. But before we begin, Jen, how you doing today?
Oh, just ducky, my dear. Just ducky. You know?
I think it's just one of those days, huh?
Yeah, it's like a smile and manage type of day. It's just and it's okay to have an off day, but we are
managing.
Sometimes we all just do it, and we're here. Ta-da!
We're here.
We're here. I'm actually excited to talk about this topic because I will say, as a clinician, it's a clinician's job and a provider's job to make sure that they get diagnosis, right? And that they educate the patient so that they understand that they need the treatment.
Right.
But then it's the role of someone on the admin team, whatever their job description, whatever their title is, I'll say, it's their job to make sure that that patient has a way to pay, right? Has a way to get that care. So whether it's financing or, payment plans, do not recommend in-house payment plans.
No, you're not a bank. Exactly. Don't act like a bank.
You're not the bank. So there's so many different companies that can help to support you with that. But having that conversation is really important. And you need to know as a clinician that when that patient goes up to the front, or goes to the admin area, that handoff is going to be good when that patient's going to come back to see you so that they can get healthier. Right?
And I want to go back to something that you said about the discussion of treatment needs and that being done by the clinicians. And while it is done obviously by the clinicians because they are the experts in this, the ones doing the exam and the treatment, it is really important for our clinicians to use everyday language when discussing treatment and not clinical jargon. Patients want to feel like you're talking with them, not at them. And sometimes clinical jargon can honestly feel belittling. Like, I don't know what you're saying. So relating to your patients in that regard, because patients, they don't buy dentistry really. They buy trust. They buy your trust. And the way that you frame your treatment is as much treatment in itself. So you have to apply a treatment to your communication style to sell your treatment, right?
Yeah, absolutely. And even as a hygienist, when we're taught in school, everything is scaling and root planing. You get out to the real world, no one knows what the heck scaling and root planing is. Like, come on, no one knows that. But you think when you graduate that everyone knows that because that's what they teach you. Well, they also teach you to do a prophy in 4 hours. So that's not real life either. But just understanding the terms and what people understand. Right? You have an active infection. You have periodontal disease, and this is how we're going to treat it. Instead of, you need to come back in for scaling and root planing. I have no clue what you're talking about, right? So really just, and making sure that, you talk about that jargon, everyone on your team needs to use the same.
Yep.
Right? Everyone needs to be calibrated.
I'm not a fan of scripting. However, I think that a foundation in language, let's say, rather than true scripting, because I don't want you to memorize it and then it to sound robotic. I want you to look at a framework, internalize it, and make it your own too. Like you said, like, you have localized periodontitis and you need scaling and root planing. I mean, no one's gonna buy that.
No.
Look, you have an infection. If we don't treat it now, it's gonna spread. and it can
Mhm.
cause tooth loss. So let's
Mhm.
handle this now before it gets worse.
Right.
And it's the best way to stop it, to keep you healthy.
Right. Exactly. And even think
That's
about too,
internalizing
yeah, like even prophylaxis.
it.
What? Right? Like it's your wellness visit. Come in,
Yeah.
your hygiene appointment. We're gonna check on everything, see how everything's going.
Yeah.
And that's, you're preventing disease at that
Yeah.
point, right? It's your preventive appointment versus your, therapy appointment because you need to have periodontal therapy, right? But
Mhm.
there's so many different things like that too. And even
Mhm.
just understanding like, well, why do I need a crown? I don't want
Mhm.
to have a crown. Just
It's a
slap a
helmet for your tooth. It keeps it strong and protected.
Yeah, thank goodness
Honestly,
they don't look like helmets, though. Can you
I know,
imagine?
hand to
Goodness
God,
gracious.
I've said that to a patient, because I always feel that the treatment needs need to be discussed in the treatment room. When they get to me in the consult room to discuss their appointments and to discuss financials, I it's my hope that by the time they sit down, they don't have any other questions about the treatment
Right.
at all. But I have said this crown is a helmet. It keeps it strong.
Hey,
Like,
but it
I
makes
said
sense,
that.
right? And I don't have long sleeves on today, but like even when I used to
Yeah.
do, your periodontal evaluation. First of all, you don't
Yeah,
say probe because people are like, "You're going to do what to me?"
right.
No, thank you. No one wants to be probed.
Mhm.
But like showing them what it means, right? Like use your finger. So I'm going to use my sleeve just because I don't have long sleeves and just show them like this is the pocket, right? And you go around. And I used to do
Yeah.
that with like my scrub jacket, right? Because it's always tight sleeves for hygiene. Um, but there's so many different things that you can do to help them understand. But as an admin team member, you need to
Mm,
know that those conversations have already happened. And that's
yeah,
why it's important that the team is calibrated on the same language that they're using, not the
right,
script that they're using,
right.
because then you're right. It does sound fake and robotic, the same language. So, what do you call things, right? We call it this, not that. We talked before in a previous episode, too, like, don't call it the waiting room because then people think that they're going to wait, right? It's the reception area, it's our welcoming area. So, just what are you going to call it as a team? And then just make sure that everyone's doing the same thing. But when
Mhm.
that patient comes out to the front, it should not be the first time that they're hearing about that treatment.
No, no,
uh,
absolutely not.
no.
And treatment really is it's about preventing pain, not being a Band-Aid for when it breaks, um,
Mhm.
which having that foundational language will only help to keep patients as healthy as possible from the get-go,
Right, right.
What are what are common barriers that you faced when you were managing Jen when it came to treatment, like normalizing concerns? Creating buy-in from the patient when
Yeah,
it comes
like
to finances,
like handling the patient's objections, right? And that's when
right?
education of your team really comes into play. And
Yeah,
the biggest thing is always finances. So you need to remove that barrier. So you need to make sure that you have multiple payment
yeah,
solutions for them, not just one. You have to have multiple because they
hmm,
might not be approved on one, but they be approved on another, right? There's so many different things out there. Um, but you need to remove the barriers, and I think that's the biggest one. Is it's
yeah,
always finances. So you need to make sure that your office has the resources for your
hmm,
team to understand, but also for your patients, so that way they can do it. And even in the comfort of their own home, like they can
hmm,
scan and apply or be pre-approved and different things like that too. There's so many different
hmm,
resources out there now.
hmm. And a couple of things that you can say to a patient who has concerns about financing. I want you to feel comfortable with the treatment plan that the doctor discussed with you, and I want you to feel comfortable both clinically and financially. So let's go over together what insurance is going to cover, and then what your investment's going to be, and what flexible options that we can offer for you.
Right.
And it's most important that You are cared for, and if it helps, let's talk about phasing treatment so you don't feel overwhelmed. There are ways to it's never just a one and done with a patient. You always have to look at the options, because the number one goal for any dental practice, this is why we're in business, is to keep people as healthy as possible. Right?
Yeah. And I would say too, don't judge a book by its cover per se, because I've had patients that have come in before and just maybe by their clothes or the way that they're dressed or anything, some of the team members might think that they can't afford it, or vice versa, or that they could afford it and they can't, right? So put every person as an equal, and just ask them the question, like exactly what you said, right? I want this to be comfortable for you clinically and to your wallet, right? And financially. Don't expect that someone can pay $500 a month, $300 a month, $200 a month. So you need to make sure that you are very flexible in what you can offer them. That is not you are the bank. It needs to be the source.
Yeah, our job isn't to pressure the patient. It's to give them the best information available so that they can make the best decision that feels right for them and their dental health.
Correct. Love it.
The strongest phrase I would always say, and I don't know if it's like cliche, if that's even the right word, but like, if you were my family member, this is exactly what I would say for you to do too. That can go leaps and bounds too, but you can't just come out of the gate saying that. Be like, hey, you're like my ma. Like, you need to do this treatment. You gotta get their buy-in before you can do that.
Yeah, absolutely. If you were my friends or family, this is I would offer them the same exact thing that I'm offering you, right?
Yeah.
It's really important that you have also that just level of rapport with them.
Yeah.
It's really important. Yeah. And last thing before we clock out, the doctor or hygienist needs to set you up for success and pass that baton in the handoff and say, Susie, this is the treatment that Dr. Smith reviewed with you today, and we talked about the importance of it. Savanah, we really need to get her in within the next week, 2 weeks at the most. I'm going to leave you with Savanah. You were in great hands with her. She's going to make sure that we can get you in the next week or two, and that you're taken care of.
I love that.
Right? It's really passing that off, because they might not know you like they know the doctor or the hygienist, right? It's really important that they do that, because if they're not going to set you up for success, you're not setting the patient up for success either.
It also encourages like a culture of listening too, right? It's the patient listening to the doctor, the admin team listening to the clinicians on walkout, and then everyone listening to the patient before the patient says yes.
Exactly. So there we go. So on that note.
Yeah. And you know what? Celebrate that case acceptance win as a team.
Yes,
you have
queen.
Great communication strategies.
Yes. Well, we are going to clock out for right now, but thank you everyone for joining us today, and we'll see you real soon.
Communicate effectively. Bye. Thanks for spending a few minutes with us on Back in 10.
If something made you laugh, nod, or feel a little more human, share it with a friend and make sure that you're subscribed.
You can also follow us on Instagram at Back in 10 Pod for more behind the scenes, updates, and probably a little chaos.
We're not here to have it all figured out. We're just here to tell you the things that we wish someone had told us.
And remind you that leadership doesn't have to be perfect, just real.
We'll be back in 10.